Good evening, my people. Let me start by welcoming you back to my YouTube channel, where, as always, we have been discussing about or giving education about common diseases which affect humankind. And I should start by apologizing because for some time, for like a month or two, I've not been able to post any video because of unavoidable circumstances. But the best thing is I'm back, and I should start by thanking those who have continued looking for me and reaching out to me to know what was happening. But now I'm back and we will continue from where we left. Let me also thank those who have continued supporting this channel, even if I was not posting any videos, by liking and also subscribing, sharing our videos. Feel appreciated. Today we are going to look at one of the common diseases or conditions that is affecting most people, especially the elderly today, and which most of you people have been requesting time and again for it to be discussed. And this is what we call kidney failure. What is kidney failure? You can also call it end-stage renal disease, kidney failure, or end-stage renal disease. If you hear somebody talk about end-stage renal disease, it simply means the fifth and the last stage of chronic kidney disease. If you hear somebody talk of end-stage renal disease, he or she is simply talking about the fifth and the last stage of chronic kidney disease. A point to note: kidney failure cannot be reversed and is life-threatening if left untreated. Kidney failure cannot be reversed. That means if your kidneys fail, it's permanent. Kidney failure cannot be reversed and it's life-threatening if left untreated. Kidney failure occurs when your kidneys, this describes what kidney failure is. Kidney failure occurs when your kidneys lose the ability to filter wastes from your blood sufficiently and may not cause symptoms in early stages. As we all know, the common name used to describe the functions of the kidney is what we call detoxification, or doing away with waste products in the blood. And if these wastes are left in the blood, they can cause other harmful complications. So, when you talk about kidney failure, it means that the kidney has lost the ability to filter wastes from your blood sufficiently and may not cause symptoms in early stages. I hope you get this point, that kidney failure occurs when your kidney lose the ability to filter wastes from your blood sufficiently and may not cause symptoms in early stages. That means when it is in its early stages, it might be asymptomatic or it may not show any symptoms at all. Kidneys filter your blood and remove toxins from your body. That is the main function of the kidneys, that kidneys filter your blood and they remove toxins from your body. The toxins go to your bladder and are eliminated when you urinate. This is very important because this disease is affecting so many people in our locality. Kidneys filter your blood and remove toxins from your body. Toxins like urea, creatinine and all that. So kidneys filter your blood and remove toxins from your body. The toxins go to your bladder and are eliminated when you urinate. So the kidneys eliminate these toxins or filter these toxins, take them to the bladder through the ureters. Then when you go to urinate, you are able to eliminate them from your body. And when your kidneys are functioning properly, all the toxins in your body are detoxified and eliminated from your body through urination. That's why I always insist, it's always good to take a lot of fluid to make sure that you urinate frequently, because the urination itself helps the body through the kidneys to eliminate these unwanted toxins. So the toxins go to your bladder and are eliminated when you urinate. When kidneys doesn't work up properly, get this very clearly, when kidneys doesn't work up properly, you can get kidney failure. As the name suggests, kidney failure, it means that your kidneys have failed. When something is failing or when something has failed, it means that it's not doing its work the way it's supposed to be, or it has failed completely. Because kidney failure has its stages, so you can describe it according to the stages, of which we will discuss as we go by. So when kidneys doesn't work properly, you can get kidney failure. A point to note, if your kidneys doesn't work properly, toxins overwhelm your body, leading to kidney failure, which is life-threatening if left untreated. A very important point to note, that if your kidneys doesn't work properly, toxins or waste products, toxin simply means waste products of the body. If your kidneys doesn't work properly, toxins overwhelm your body, overwork your body. Toxins overwhelm your body, leading to kidney failure, which is life-threatening if left untreated. Let's look at the types of kidney failure. Let's look at the types of kidney failure. Acute kidney failure. Acute means its onset is rapid. Acute kidney failure occurs when your kidneys suddenly stop working properly. Get this very clearly. Acute kidney failure. So your kidneys might be having acute kidney failure or chronic kidney failure. Acute kidney failure occurs when your kidneys suddenly stop working properly, while chronic kidney failure occurs over a time. So in acute kidney failure, onset is sudden, while in chronic kidney failure, it occurs over a time. Kidney failure is divided in 5 types. Apart from the acute and the chronic, we have other 5 types which we are going to discuss. Kidney failure is divided into 5 types. Number 1, acute prerenal kidney failure. Acute prerenal kidney failure. Here we have insufficient blood flow to the kidneys. So the blood flowing to the kidneys is not enough or it's insufficient. And this can cause this type of kidney failure. So acute, which is acute means sudden. So acute pre-renal kidney failure means that there is insufficient blood flow to the kidneys and can cause this type of kidney failure. It can be cured once the cause of decreased blood flow to the kidneys is determined. So for you to cure this type of kidney failure, you have to establish or determine the cause of the insufficient blood flow to the kidney. Let me repeat this again. Acute pre-renal kidney failure. Here there is insufficient blood flow to the kidneys and can cause this type of kidney failure. It can be cured once the cause of decreased blood flow to the kidneys is determined. The second type of kidney failure is what we call acute intrinsic kidney failure. Acute intrinsic kidney failure. This type of kidney failure can result from direct trauma to the kidneys. Acute intrinsic kidney failure can result from direct trauma to the kidney, for example, from physical impact or accident, toxin overload, and ischemia or lack of enough oxygen in the kidneys. Let me repeat this again. Acute intrinsic kidney failure. It can result from direct trauma to the kidneys, for example, physical impact or accident, toxin overload, and ischemia or lack of oxygen in the kidneys. Ischemia simply means lack of oxygen in the kidneys. This marks the end of our first video today, and in our second video we will continue with the third type of kidney failure. And I hope you guys, and mostly those who had requested this topic and have been waiting for it, I hope you are getting what you are looking for, and you will follow me till the end, because this is one of the conditions that is killing many people, especially the elderly in our society. So let's continue liking and subscribing and sharing this video so that it may reach as many people as possible. And thank you for the support you are showing to this channel, because it's only because of your support that this channel is where it is at the moment. Let's continue pushing, and I hope we will continue learning from this channel. Let's have a good evening and meet in our next video.